Welcome, everyone. We're so glad you've joined us for today's webinar, Exploring the Impacts of Meaningful Community Health Worker, Promotores, and Community Health Representative Investment. My name is Kusi McKenzie, and I'm the Director of Strategic Initiatives at Health Leads, and will be serving as today's moderator. Next slide, please. Before we get started, we have just a couple of quick tech instructions. To listen to this webinar in Spanish, please click on the globe icon at the bottom of your Zoom screen and select Spanish. Everyone, including Spanish speakers, must select a language to ensure a smooth interpretation experience. If you would like to view the slides in Spanish, click Spanish Slides at the top of your Zoom screen. Everyone, including English speakers, must select a slide deck language to ensure a smooth experience. You can also turn on closed captions by clicking on the CC icon and showing the subtitles. Para escuchar este seminario web en español, haz clic en el icono de globo en la parte inferior de tu pantalla de Zoom y selecciona Español. Todos, incluidos los hablantes de inglés, deben seleccionar un idioma para garantizar una experiencia de interpretación fluida. Si quieres ver las diapositivas en español, haz clic en Diapositivas en inglés en la parte superior de tu pantalla de Zoom. Todos, incluidos los hablantes de inglés, deben seleccionar un idioma de la plataforma de diapositivas para garantizar una experiencia fluida. También puedes activar los subtítulos cerrados haciendo clic en el icono CC y seleccionado Mostrar subtítulos. The speakers, including myself, will do our best to speak clearly and at a steady pace to help create a quality audio experience for the attendees listening to the webinar in the Spanish channel. Javier Morone and Gabriela Moya are our interpreters today from Lex Lingua Court Interpreters. We want to acknowledge Javier and his team for supporting us for the last 4 years in making all our events and materials bilingual and thus more inclusive. Muchas gracias. Next slide, please. This work was made possible through the generosity of the California Healthcare Foundation, with additional support from Cedars-Sinai. Here's what we'll be covering today. We'll do an overview of the Amplifying Impact Initiative, go into the evaluation findings, hear from grantee panelists, have a Q&A session, and then close out with introducing the final Pillar 2 subcontractors. Next slide, please. Before we begin, I want to take a moment to ground us in land acknowledgement. I'm joining you today from St. Paul, Minnesota, which is the native land of the Dakota people. I honor their enduring connection to this land, past and present, and recognize the strength, resilience, and contributions of Indigenous communities across the country. In the chat, we invite you to introduce yourself, where you're joining from, and the name of the Indigenous nation whose land you're on. You're welcome to share how you acknowledge or take action to honor the land of those people. I'm going to drop a couple links in the chat in case you need help identifying the native land that you're on. Next slide, please. The practice commitments that you see here have been adopted from our Health Leads culture. Our best practice is to start meetings by pausing on these commitments to center our conversation and set intentions for our actions in the conversation. The commitments were developed to facilitate better, safer, and deeper dialogue. These commitments are: be present, brave and curious, create an inclusive space, invite anti-racist dialogue, and be accountable. Now we'll pause for a moment to center these commitments. During the pause, folks are welcome to uplift certain commitments in the chat. Next slide, please. In addition to our panelists, you'll get to meet Allie Hu-Nguyen, Senior Consultant at Bright Research Group, who has been leading the evaluation of the Amplifying Impact Initiative and will be serving as today's facilitator and sharing evaluation findings. But first, I'd like to invite Carlina Hansen, Senior Program Officer at the California Healthcare Foundation, to share an overview of the initiative.
Thank you so much, Kusi. Good morning, everyone, and welcome. As Kusi said, my name is Carlina Hansen, and I'm a Senior Program Officer at the California Healthcare Foundation, where I have the deep privilege of leading our work on community health workers, promotoras, and community health representatives. Before we begin, I want to recognize the many, many people and organizations who made the Amplifying Impact Initiative possible. I want to thank Bright Research Group for an evaluation that doesn't just document what happened, it captures the voices, the experiences, and the lessons of the organizations doing this work. I want to thank Health Leads, the fabulous team you'll see today, for your leadership and for partnering with organizations every step of the way with an unwavering commitment to health equity. Thank you again to Lex Lingua for your many years of fabulous interpretation. Appreciation to our colleagues at Cedars-Sinai for their partnership and co-funding, which helped to make this initiative possible. And finally, and most importantly, my very sincere appreciation to the 28 organizations that participated in Amplifying Impact for your leadership, for your innovation, and for your dedication to your communities. I want to begin with something we often hear from community members. People do not say things like, I need better care coordination. They say, I finally found someone who listened. They do not ask for a new care delivery model. They say, someone came with me, someone spoke my language, someone helped me find my way. And they're talking about somebody they trust, and that someone is often a community health worker or a promotora. But trust, while it's really important, is only the beginning. Our challenge is not just to support community health workers, it's to build systems that are worthy of the trust that they create. And that means connecting people to care, connecting community organizations with health plans and providers, and designing programs that start with community needs rather than expecting communities to adapt to our systems. And that is what Amplifying Impact has shown us. Lasting change happens when we invest not only in people, but in partnerships, in infrastructure, and in collaboration that allows community voice to shape how care is delivered. As we face renewed challenges to healthcare coverage, to access, and to trust, these lessons matter more than ever. Community health workers and promotoras are essential, but so are the systems and the sustained investments that enable them to do what they do best, which is to improve health by meeting people where they are and to advocate for the communities that they serve, that you serve. I want to thank you for joining us today. I want to thank you for everything that you do to advance more equitable, community-centered care. And with that, I will pass it to Allie, who will talk to us about our evaluation findings. Allie.
Great. Thank you so much, Carlina. And can we get the next slide, please? Well, good morning, everyone. I'm Allie Hu-Nguyen. I'm the senior consultant at Bright Research Group. We're a small, women of color-owned research and evaluation design firm in Oakland, California, and we're the learning evaluation partners for Amplifying Impact Initiative. We're so honored to have partnered with the co-funders, California Healthcare Foundation and Cedars-Sinai, to evaluate the impact of this important initiative in expanding access to community health workers, promoters, representative services throughout California. We're really excited to share the findings from the evaluation today. Next slide, please. Before that, I want to acknowledge our team, Bright Star Olson, CEO and principal, and Lauren Ferrer-Cardosa, senior consultant, who have contributed to this work. And of course, our amazing partners at Health Leads. Importantly, on behalf of Bright Research Group, we want to thank all the grantees, their partners, the community health workers, promotores, representatives for their participation in the evaluation. It's truly an honor to lift up your strategies and stories of impact. Next slide, please. All right. I got to tell you about our evaluation methods before I talk about the findings. So the evaluation was guided by these 4 key questions on the left. Our team also conducted a midpoint evaluation where we interviewed different stakeholders, including grantees, community health workers, to really understand their experience in integrating services into Medi-Cal, including California Advancing Innovations in Medi-Cal, which is CalAIM, and the community health worker benefit. At the end of the initiative, we used a mixed method approach of interviews, small group conversations, analyzing grantee reports to capture the impact of collective grantees towards the goal of scaling the community health worker workforce, strategies that work, challenges, and lessons learned. All right, now let's talk about what we found. Next slide. So over the 18-month initiative, the Amplifying Impact 28 grantees strengthened and scaled the community health worker promotora representative workforce in California. Collectively, their efforts led to supporting over 100 organizations with established Medi-Cal billing. They trained and they hired over 350 community health workers and promotoras who spoke over 10 different languages, which led to expanding access to a healthcare delivery system that provides culturally and linguistically responsive services to their members. As a result of this work of community health workers, meeting people where they're at, connecting folks to care, 9,000 Medi-Cal members with complex health and social needs were served through CalAIM. Over 3,400 members were provided with the preventative health services and education that they needed through the community health worker benefit. I already see some great celebration in the chat. Just want to take a moment to really celebrate the accomplishments of our grantees and the community health workers, of yourselves in this room, and the impact that you've had on the health and well-being of thousands of Californians. All right. Great. Let's go on to the next slide. So the evaluation serviced 3 key strategies that the Amplifying Impact grantees used to successfully increase access and scale community health worker services, as well as the ongoing challenge of financially sustaining this work. I'm going to talk about each one of these in depth. Next slide. So first, we found that Amplifying Impact grantees expanded access to care by building and leveraging strong community partnerships. They established partnerships with faith communities, cultural centers, and other community-based organizations, embedding their community health workers there to meet people where they're at, to reach and identify eligible members and connect them to care. For example, a federally qualified health center developed a new referral pathway with a local food bank, and their community health workers were on site to provide free blood pressure screenings to shoppers and connected them to primary care providers. Grantee organizations and their community health workers were also able to reach communities that experience cultural and linguistic and systemic barriers to care. Many of them expanded access to populations who are newly eligible for enhanced care management. In a moment, we're going to hear from the enhanced care management team from Vital Space. They're going to share about how they partnered with the Jurupa Valley School District in the Inland Empire to reach and connect students and families with complex social health care needs to critical services. All right, next slide. So what this finding points to is that community-centered partnership and embedding community health workers in trusted community settings increases access to care, coordination, and supportive services. which in turn strengthens the implementation of CalAIM and the Medi-Cal Community Health Worker Benefit. All right, next slide. So secondly, the evaluation suggests that collaboratives play a very significant role in building the infrastructure needed to scale community health worker workforce and services in the region and also across the state. Intermediate organizations are often the ones who lead and align efforts within these collaboratives. Without the resources and supports of these collaboratives, small community-based organizations would not have been able to take advantage of the Medi-Cal Community Health Worker Benefits funding stream. Intermediate organizations often offer community-based organizations the technical assistance and the funding to create the billing and data infrastructure support and meet other requirements for the community health worker benefit. Some also establish partnerships with Medi-Cal community care hubs to create shared infrastructure in their region, or they even act as community care hubs for their network of providers. They also cultivated and leveraged partnerships with their local managed care plans to provide technical assistance and support their partners on their journey to become supervising providers. Later, we're going to hear from Lead Filipino about how being part of the Santa Clara County Asian Pacific Islander Community Health Network supported their ability to contract and bill for Medi-Cal through the Community Health Worker Benefit for the first time through this initiative. The community health worker collaboratives across the state also convened and fostered learning among their multi-sector partnerships. At convenings, partners identified solutions to key challenges, including the integration of community health workers into Medi-Cal and ways to expand access to services. Community health workers were often at these tables, and they voiced their priorities and their experiences. Collaboratives also focused on strengthening the regional workforce. That reflects the experiences, culture, and lived experience of communities that they serve. Many grantees trained and certified cohorts of community health workers, promotores, and representatives during this initiative. Finally, collaboratives advanced financial sustainability by piloting braiding funding models and securing additional funding to continue this work beyond amplifying impact. Next slide, please. Thanks. An important takeaway from amplifying impact is that collaborative models, they create the regional efficiencies and the infrastructure that enables the scaling of the community health worker workforce and their services. They also accelerate learning, which enables an ecosystem of multi-sector partners to arrive at solutions to common implementation challenges. All right, let's talk about the next strategy, investing in the community health worker workforce to expand access to services. Next slide, thanks. Grantees across the state demonstrated when you value and you invest in community health workers, their professional development, job quality, leadership, then a thriving workforce can better support their community's health. The integration of a diverse community health worker workforce enhances the ability of local healthcare delivery systems to be more culturally and linguistically responsive to the diverse experiences and cultures of Medi-Cal populations. During the Amplifying Impact Initiative, grantees invested in the workforce by recruiting, training, and certifying community members as community health workers. Some developed their own cultural and language-specific trainings, like in Spanish and Vietnamese, so that more community leaders can access training and certification. Others created trainings so that community health workers can better serve specific populations, like people with the experience of homelessness or incarceration. Grantees also train cohorts of community health workers and their supervisors to provide services specifically for enhanced care management and the community health worker benefit. Many also focused on creating training pathways through ongoing education and professional development that supports community health workers' ability to provide quality services and be the leaders that they are in community health. Later on, we're going to hear from Homeless Prenatal Program in San Francisco and about how they expanded their community health worker apprenticeship program through partnerships with other family resource centers and San Francisco City College to train and certify more people with lived experience as community health workers. Finally, grantees also convene community health workers across the region or the state to build community, support peer learning, and address challenges, especially around navigating changes in the Medi-Cal policies, such as the Medi-Cal Community Health Worker Benefit and the impact of HR 1 on the communities they serve, and also often on community health workers themselves. Next slide, please. So what we learned from grantees is that investing in the community health worker workforce development is critical to ensuring that communities have access to providers who understand and reflect their language, culture, and lived experience. So now let's talk about the persistent challenge. Next slide. Next slide, please. Thanks. All right. The challenge emphasizing by all groups that we spoke to, grantees, their community health workers, managed care plan partners, is that the Medi-Cal reimbursement alone is not sufficient to sustain access to community health worker services in California. 3 concerns arose. First, the Medi-Cal reimbursement doesn't cover the full scope of services provided by community health workers, especially given the time-intensive, relational, responsive nature of their approach to serving community that is at the heart of community health work. For organizations to be able to bill for Medi-Cal, there's substantial startup and ongoing investment in infrastructure like billing systems, electronic health record systems, staffing that is required. That small community-based organizations simply can't afford. And as we just talked about, there needs to be investment in community health workers themselves, competitive wages, career advancement, all that is needed to retain and sustain the community health worker workforce, who are the vital connections to community members. The evaluation found that Amplifying Impact grantees are addressing these challenges in so many ways, including creating funding, creating shared infrastructure, and strengthening partnerships with managed care plans. So what does this mean for future policy and investment in California's community health worker, promotora, and representative workforce, and bringing care closer to and services closer to communities? Next slide. So the evaluation surfaced 5 key priorities for consideration. First, to invest in community health worker collaboratives that create that regional and statewide infrastructure needed to scale and strengthen access to community health worker, promotora, and representative services. To encourage flexible funding approaches that enable braiding of multiple diverse funding streams, and funding models that recognize the full value of community-based community health worker services. In the same vein, we want to preserve and lift up community-centered, culturally responsive approaches that really is at the heart of the work. And finally, and more importantly, investing in the community health worker workforce, as they are that vital connection between community, healthcare, and social service systems that lead to improved healthcare and health outcomes for all Californians. All right. So now we get to do the fun part. I'm really excited. Next slide. That I get to pass the mic to 3 Amplifying Impact Initiative grantees. The Center for Translational Institute's Enhanced Care Management team at Vital Space, the Santa Clara County's Asian Pacific Islanders Community Health Network and Lead Filipino, and the San Francisco Homeless Prenatal Program. They're going to share with you all what these strategies look like in practice and the critical role of their community health workers who are joining them today in this webinar, and what they've learned about expanding and sustaining access to services through CalAIM and the Medi-Cal Community Health Worker Benefit. Next slide. So first, we're going to hear from the Center for Translational Research Institute and the Vital Space Enhanced Care Management team, Andrea, Silvia, Jaime, and also Aparna Jain. Through the Amplifying Impact Initiative, they launched the Vital Space in partnership with the Jurupa Valley School District, and their work really demonstrates the impact of strong community partnerships that integrate systems of care and impact of expanding enhanced care management to a new population of focus. So with that, I'm going to pass it to Aparna.
Thank you, Allie. Hi, everyone. Good morning. My name is Dr. Aparna Jain, and I'm the Director of Community Supports at Community Translation Research Institute. And along with me, I have two more presenters from CTRI. We call it CITRI. We have Andrea Silva Jaime, who is our community health worker at CTRI and who serves as a community health worker with the ECM team. And we also have Dr. Arzu, who is also a community health worker with the ECM team. So next slide, please. So before diving deeper into the services offered by CITRI and the achievements and the impacts we have had in the community so far, I would like to talk a little bit about CITRI. CITRI is Community Translation Research Institute, and it was founded by two professors at the Claremont Graduate Universities, Professor C. Anderson Johnson and Professor J. Orr. They are the founding deans of the School of Community Medicine, the School of Community and Global Health at CHW. And it was found in year 2014, and since its inception, it has been dedicated to advancing health equity and improving the well-being of underserved communities through innovative research, education, and community-based programs. As the name suggests, it is a translation research institute. What would that mean is it translates theories into practice. So whatever theories we have learned in our graduate studies, we translate them into practice. So CITRI's mission is to expand its research and intervention efforts both in the US and internationally to develop community-based mental health initiatives. Next slide, please. So one of our arms at CITRI is the service delivery arm, and the services that are being delivered to the communities is through a physical center, which we call the Vital Space. So the Vital Space is located in the Rupa Valley region in the county Riverside, and it is co-located with the Rupa Unified School District in Rupa Valley. And this particular center, the Vital Space, it has two teams, which provides enhanced care management services. And another team is a team that provides community health worker services to the people in the Riverside and San Bernardino counties. It was started in the year 25 in July 25. So we are celebrating 1 year of the Vital Space presence in the Riverside region. And it was developed in partnership with Inland Empire Health Plan. And as I mentioned, it is co-located with the Rupa Unified School District. So it gives a unique opportunity of connecting with the students at the Rupa Unified School District, providing them and their families services. Along with the students at the Rupa Unified School District, we also are connected with the Riverside County individuals. For the ECM team, we serve individuals who are less than 21 years. So our population of focus is children and youth less than 21 years for the ECM team. But for the community health workers team, we are covering people from all age groups. And I would like to mention that for the ECM team, we provide coordinated care for families with complex needs through a whole person and team-based approach. Can you please change the slide? So I already mentioned that at the Vital Space, we have two teams, one team that provide the enhanced care management services, and the other team which provide the community health worker services to the Riverside and the San Bernardino County individuals. And the services that we offer is multi-ethnic and bilingual. So what does that mean? We have a team of around 12 to 14 individuals that are across different specialties, including nurse practitioner, behavioral health manager, community health workers, and care coordinators. And we provide services to the Spanish individuals and to the different linguistic groups in the Riverside and the San Bernardino County areas. Among all these cross-specialty team members, the community health workers have a vital role, and this vital role spans around providing outreach services, building trusted relationships in the community leaders, administering initial assessments with individuals, and providing health education support with healthcare navigation and existing members. Can we have the next slide? So I would like to hand it over to Andrea for this particular slide.
Hi everyone. Like Dr. Aparna mentioned, my name is Andrea. I'm the community health worker with our team, and I first want to go over some of our achievements that we have noticed. As she mentioned, we're reaching our 1 year mark here with the ECM team. So here something that we've done, within the first 11 months was that we have about over 6 community members trained as CHWs through IHP as we're partnered with them. And over the first 11 months, we conducted over 6,000 outreach activities. We've also enrolled about 154 members, and that number is always changing. And out of these, sorry, I'm like, the comments. Out of these 154 members, 78% of them are receiving care coordination and they're under 21 years old. And something else that we have recently accomplished was creating our CHW program, serving the Inland Empire, which launched in May officially. And so the way this works is since there's so many requirements that need to be checked off to qualify for the enhanced care management team. Now that we have this program, if members don't qualify for the ECM team, we work with our CHW program and we just transfer them with them so they can still get the help they need for their health. So that has been a great accomplishment because we're able to help everyone now, which is very great. And on the right side, we have a table, a bar graph that's care coordination services, distribution of cases. And so the first 31% out of our members, we have been helping them with food assistance. 17% of them, it has been housing assistance, 20% transportation, the 3% has been with billing and utility bills. The 16% we've helped with economic and financial assistance. The 5% with in-home supports, 2% with employment services, and the 7% the academic support. Sorry, that was out of order. But yeah, these are just some numbers to show how we've been able to help them in different areas of health. And yeah, so can we go to the next slide, please? Okay, so some of the impacts as a community health worker that we've seen with our cases has been that we've been able to help them increase access to their health care, community resources, housing services. We've improved their appointment scheduling with like their doctor's appointments, behavioral health, or any of that sort, with care coordination and follow-ups. That's something very big that we do. We like to, whether it's monthly, every 2 weeks, we try to keep track with them just to check in, making sure they're okay. So we've noticed that's a big impact, knowing for the members to know that we have them, like we're helping them and we're with them in their journey. And we've also enhanced access to health information and resolved insurance issues, and such as IHP, like when their insurance is expiring, soon to be expired, or just giving them the different options on how they can go about fixing their insurance issues. And we've also helped connect clients to their doctors, their PCPs, it's surprising the amount of members that sometimes they don't even know who their PCP is. And so we help them with that. We've also increased their confidence in navigating their healthcare and social services while building trust with the healthcare teams, which I think is a key factor when it comes to all of this, because without trust, you can't really help them and they most likely won't let themselves be helped. So that's something very big we focus on here. And providing emotional support, leaving clients and families feeling more informed, supported, and empowered. Can we go to the next slide, please? And with all of this, we have some lessons learned that we've been learning throughout our whole program from the members, from each other. And that's collaboration between the team. That's very key because it's not just one person doing all the work. Everyone's role is very important and everyone plays a huge impact on the member's journey. And trust and relationship comes first. Like I was mentioning, building trust is very big. It's like the foundation of helping a member because without it, there isn't much communication. And also, CHWs reduce barriers, save time, and improve health equity by providing consistent support, advocacy, and connecting clients to needed resources. We've also learned that health literacy and language barriers are very significant obstacles to accessing healthcare, especially in immigrant communities, which is something we've been trying to help many members with. And also, healthcare navigation being essential. Many individuals need guidance to navigating healthcare systems, not just medical care, as well as addressing social determinants of health, such as housing, insurance, transportation, food access, and emotional well-being leads to overall health outcomes. That's something that we really advocate for in our program. We don't just focus on one thing. We like to look at everything because any little thing can be affecting one's health, which can be something stress, something going on at home, just the environment. Like that's something that we really need to focus on. And we try to do that with our team and help our members with. And as well as interpreter services and care coordination to improve appointment attendance, community, and continuity of care. A lot of times that's what's keeping people from going to their yearly checkups, or just simply asking for information that can be like food assistance, transportation, and something very nice here at our team because we're so diverse. Many of us speak at least more than one language, and it's been very helpful when communicating with our members. And just a little side quote, which is at the top corner, is small interventions, consistent support, and trusted relationships create lasting change. And next question. Sorry, next slide. Okay. Yes, thank you.
Thank you so much, Andrea and Aparna, for sharing about the vital work that you all do in Herpa Valley, and the ways that your community enhanced care management team and community health workers meet people where they're at and support them in navigating and connecting to lots of different services. So next, we're going to travel north to Santa Clara County, where we will learn about how the Asian Pacific Islander Community Health Network, API Community Health Network, is creating the regional infrastructure to sustain and scale access to community health workers for their community. We'll learn from Gerard Manuel from Asian Americans for Community Involvement, who's the backbone and lead organization for the network, and Marnelli Canosa from Lead Filipino, a community health worker, and how they tested out and implemented the Medi-Cal community health worker benefit.
Thank you, Allie. Thank you, Allie, and good morning, everybody. My name again is Gerard Manuel. I'm the Director of Wellness Services for AACI, and on the call with me, or on the presentation with me, will be Marnelli Canosa, a community health worker from Lead Filipino. Next slide, please. Let's go ahead and go to the next slide. The API CHW network launched in March of 2021 to address health inequities affecting Asian and Pacific Islander communities in Santa Clara County. The network grew from the 2017 Santa Clara County API Health Needs Assessment, which highlighted the barriers many API residents face, including language access, social isolation, and difficulty connecting to health and community services. We are grateful to the Santa Clara County Public Health Department for recognizing the need for a community-led response and investing in culturally specific organizations already trusted by the residents. The network brings community-based organizations serving Chinese, Filipino, Indian, Korean, Pacific Islander, Japanese, and Vietnamese communities. AACI serves as the network convener, backbone agency, and regrantor. Our role is to provide shared infrastructure that strengthens the work of each partner. AACI coordinates the network, manages the funding, provides CHW training and technical assistance, and connects partners to healthcare and funding opportunities. This shared structure gives partners access to resources they may not secure alone, while the network benefits from each organization's cultural knowledge, language capacity, and community trust. That mutual exchange is the foundation of the network. Next slide, please. The strength of this initiative comes from its partners. The network includes AACI, the lead agency, International Children's Assistance Network, India Community Center, Korean American Community Services, Lead Filipino, Regional Pacific Islander Task Force, SEVA Bay Area, Vietnamese American Roundtable, Vietnamese Voluntary Foundation, and AACI, with the support and partnership of Santa Clara County Public Health Department. Together, these organizations serve 7 priority API cohorts across Santa Clara County. Each partner understands the language, culture, health concerns, and barriers experienced within its own community. AACI provides the coordinating structure, but the network succeeds because our partners bring trusted relationships and cultural expertise. Their willingness to coordinate outreach, share lessons, participate in training, test new approaches, and support one another has transformed individual programs into a regional collaborative. Over the past 4 years, the network has trained 55 culturally and linguistically representative CHWs, delivered more than 1,300 health education trainings and activities, and conducted more than 25,000 in-person community encounters. Building on the county's initial investment, AACI has secured additional support from multiple funding partners, expanding workforce development, culturally specific training, outreach, and community health initiatives. These achievements belong to the entire partnership. Our community-based organizations, CHWs, community members, Santa Clara County, and the healthcare and funding partners that invested in this shared infrastructure. Next slide, please. Before I turn over to Marnelli, I want to go ahead and briefly introduce AACI. Founded in 1973, AACI has served Santa Clara County for more than 50 years. Our mission is to strengthen the resilience and hope of our diverse community members by improving their health and well-being. Our vision is that everyone in our community is healthy, safe, and well. AACI provides an integrated system of primary care, behavioral health, dental, and wellness services, including community-based support and safety net programs for youth, families, survivors, and older adults. Across this work, we have learned that access depends not only on whether services exist, but also on whether people trust them, understand them, and can receive them within their language and cultural context. That understanding guides AACI's backbone role. As the network evolves, AACI remains focused on strengthening the training, technical assistance, reporting, and partnerships that support the network's collective capacity. The goal is to help our partners continue doing what they do best, providing trusted, culturally, and linguistically responsive services in their communities. For healthcare professionals, the network demonstrates that successful CHW partnerships require more than referrals. They require shared planning, investment in community capacity, clear communication, and respect for the expertise of trusted community organizations. AACI is proud to serve as a backbone agency, but the network's success belongs to all of the partners who have built and sustained it. I would now like to turn the presentation over to Marnelli to talk about Lead Filipino and their experience in implementing the CHW benefit.
All right. Good morning, everyone. My name is Marnelli, pronouns she, her. With Lead Filipino, I serve as their Senior Field and Outreach Coordinator, overseeing our tabling initiatives as well as our health equity work. So Lead Filipino is a nonprofit organization based in San Jose with chapters in San Antonio, Texas, and Las Vegas, Nevada. Our health equity work primarily lives in Santa Clara County, and it is a testing ground for our various chapters, as we know that building people power amongst the Filipina AXO diaspora is super important. We do this through civic engagement, voter education, grassroots leadership development, and health equity, bringing in a culturally competent lens and meeting our folks where they're at. Our grassroots campaigns and organizing efforts have led to conducting the first Filipino cancer survey in Santa Clara County, the naming of Delano Manong's Park in East San Jose, and producing the first Filipino Advocacy Day with the Fierce Coalition in Sacramento. All right, next slide, please. Cool. Within our health equity initiatives, we have multiple pillars. Our main one has been holistic health workshops, and within this capacity, we focus on various topics relating to the social determinants of health. Our past workshops have included Alzheimer's dementia, healthy relationships and intergenerational conversations, as well as light movement through yoga classes. Our target demographic is transitional aged youth, so 18 through 35 years of age, and we package complex topics into digestible 1 to 2 hour workshops that dispels misinformation and is presented by an AA and HPI speaker. When our community members see a familiar face, they're more likely to trust the information and be receptive to resources brought in by our community partners like AACI. We also have various outreach and tabling opportunities throughout the year. So as a part of our grassroots organizing methods, we're always meeting community members where they're at. Lead Filipino started off doing voter registration work in front of Jollibee and Seafood City. These are popular Philam stores. You may have heard of them as well. So we've integrated vitals checks at festivals where people gather so they could check their blood pressure. We have older titas or aunties who are hesitant to approach us because they are scared of how high their numbers are. But we destigmatize the shame and these health talks into a curious conversation of support and encouragement. They're more receptive to having this conversation with a Filipino CHW as opposed to their PCP. Since then, we've evolved to passing out community resources like fentanyl tests and Narcan, and we're braiding in our program initiatives. So red cards to assert your rights when you come across immigration, law enforcement, event flyers, and voter registration and education. In the top corner, you see a door hanger that we pass out during our voter engagement work. So when we're knocking on doors to provide voter resources, we also pass out these door hangers with our resource directory focused on the Filipino AXO communities living in Santa Clara County. There's also a link to connect with us for CHW services. In the past year, we built out the infrastructure for our CHW billing and formalized our service referral processes to bill for Medi-Cal. And after being in my role for 2 years, I became a certified enrollment counselor and completed my CHW certification in June. I was able to continue billing against Medi-Cal up until our primary election campaign in May and June. This outreach is also a method for community research initiatives, which I'll talk about the evolution of our work in the next slide, please. Next slide. Perfect, thank you. So in braiding different initiatives into our outreach, we were able to lead the first Filipino cancer action study with the Stanford Cancer Institute. As some background, 1 in 4 Filipino AXOs in the US work in healthcare, but we don't have a clear snapshot of our health needs. Just stories from our elders and anecdotes about how our bodies react through generations. So having explicit data allows us to address the social determinants of health, as we see with reports that was just shared in the chat, and the 2017 AA-NHPI Health Needs Assessment. This then creates a case for evidence-based programs to treat illnesses that impact our community, including higher rates of cancer in the Filipino AXO community than other AAPI groups. We were also able to build out our capacity through a health educator program called Kalusugan Health Advocacy Program. With that, we are developing leaders and pipelining them into CHW certification programs and staying engaged with our health equity initiatives. We talk about the Filipino AXO health disparities through the lens of community health workers and tie in health equity and advocacy techniques. And it's important so we could train them on the fundamentals of CHWs through any field of public health that they work within. Last year, we were able to train 12 folks. We just had our first session last night, and we have 21 registered folks into our program. And this is only the second cohort. This program also served as a way to fill in the gaps as our social services are cut, and provide resources, service referrals, and vitals checks, and health education from a trusted source in a time of AI-generated content and misinformation, which is plaguing our communities. Next slide, please. Okay. And then I'll pass it off to Gerard to talk about the overall impact.
Yeah, and I did mention quite a bit about the work that we've been doing. On average, our network does about 350 to 400 workshops annually. Those are workshops, that's not outreach. Facilitated and coordinated 40 plus trainings in the last 4 years covering mental health topics, chronic disease management topics, more recently about healthcare access and the importance of healthcare access. And we've been working very closely with different partners on helping the community advocate for themselves as a patient coming into a health center. We've trained over 50 CHWs in 25, 26. 26 completed the CHW training course. We just rolled out a Vietnamese specific training for the community, and we had just completed the Korean curriculum translation, and we are now working on the Korean curriculum presentation piece, and we're hoping to roll that out by next year. We have 16 certified enrollment counselors. I'm in Lead Filipino. I think you saw on here their achievements and accomplishments. Marnelli, do you want to highlight any of these?
I would say in terms of our outreach last year, we were able to reach about 2,000 folks. And with our consistent vitals checks, we've provided 160 blood pressure checks and had those conversations with people. Yay!
Thank you, Marnelli. And maybe going into just kind of what we've learned, one of the biggest benefits of the things that we are learning is we're learning the very importance of translation and the nuance requirements of the community when it comes down to cultural information and care. And so we've been trying to work with many other partners in the community and helping them navigate how do you teach this particular topic area to the Vietnamese community. We actually hosted a nice exchange where a partner walked us through the curriculum, and then the CHWs provided input on how that might be received. So it was a great exchange, and hopefully there will be future other ones. And then other things we've learned, and the challenges, it takes time, and the time it takes to ramp up. And along with that, all of the costs to ramp up. So I think one of the things we're trying to figure out is how do we support new organizations that have just joined the CHW benefit space? How do we help them be successful? And so that's kind of what we're working on as well, is providing that support and assistance to the community. Outside of that, I think I'm going to go ahead and put it back to Allie.
Great. Thank you, Gerard and Manuel. Thank you so much for sharing about the network's accomplishments and also the importance of culturally competent and nuanced services and care. All right, we're going to head across the San Francisco Bay Area now to the Homeless Prenatal Program to learn about the Community Health Worker Apprenticeship Program. And their work really underscores the importance of developing and scaling training pathways for people of lived experience to become certified community health workers. and provide them competitive wages and opportunities for career advancement. So let's hear from Betty Espinoza, who is the Associate Director of Apprenticeship, and Christy Karobi, who's a Community Health Worker Apprenticeship graduate who has been recently promoted to the ACM coordinator. So pass the mic to you, Betty.
Good morning, everyone. Thank you for having us. Christy and I are super excited to be here and talk a little bit about our work. As Allie said, my name is Betty Espinoza, and I'm the Associate Director for the CHW Apprenticeship Program here at HVP. And we'll introduce Christy as well. Next slide, please. All right. So basically, we'll talk a little bit about what the program entails. And just to give you a brief history, the Homeless Prenatal Program has been hosting community health workers since the beginning. So we've had CHWs over 30 years. And in 2020, we moved to the apprenticeship model as well. So we have seen many of our CHWs come our way, from former clients to people in the community. And I think that's something that has worked in this agency, just to have the lived experience from the people from the community or former client come in and get the instruction that they need and investment that they need for them to give back to the community. For the next 4 slides, I'm going to invite Christy to present. Christy. And
Good
next
morning,
slide,
everyone. Next slide. As mentioned, I am a former CHW graduate. I graduated in May of this year. I have recently been promoted as the Bilingual New Beginnings and ECM coordinator here in our New Beginnings department at Homeless Prenatal. Next slide, please. So here, what we do at Homeless Prenatal Program as community health worker apprentices, HPP is nationally recognized family resource center in San Francisco that empowers homeless and low-income families, particularly mothers motivated by pregnancy and parenthood, to find within themselves the strength and confidence they need to transform their lives. At Homeless Prenatal, we provide a variety of programs and services to help families become healthy, stable, and self-sufficient, such as groups and classes and things like that. Who we serve, our target population is pregnant and or parenting families, children 0 to 5. Our service population is all families with children up to age 17. We serve 3,500 families annually. Just to see a little bit of numbers, 50% of our families that come in report as homeless in the intake process. 25% of them are pregnant. 85% of our clients are women of color, and 45% are Spanish speakers. All report incomes far below the federal line of poverty. Next slide. Okay, so for the CHW program, like Betty has said, there's been 35 years of experience working with low-income families and homelessness families here. HPP knows that sustainable employment and economic security are key to creating and maintaining stability. The CHW apprenticeship program is a 16-month on-the-job paid program. It's offered to former clients and members of the community. This program combines classroom instruction with CCSF as well with on-the-job training experience. As it says that it is offered to former clients, I myself was a former client at Homeless Prenatal who is now on the other side serving community. A community health worker also builds individual and community capacity by increasing health knowledge and self-sufficiency through a range of activities such as outreach, community education, informal counseling, social support, and advocacy. Next slide, please. Here we have our most recent graduating CHW class, which was my cohort that I was in. CHW apprentices receive on-the-job training in reception skills, client intake, outreach, database competency, and other technologies. We also attend City College classes to attain CCSF CHW certificate, and we complete externships while earning a living wage with graduated increases as goals are met and proficiencies grow. One of the beautiful things about working in the apprenticeship program with Homeless Prenatal and collaborating with CCSF is that the educators come to us here on site. We don't ever have to go to CCSF campus. Everything is done in-house on the clock. So we pretty much don't take work home with us, which is something that was very like a beautiful thing about the whole program. Next slide, please. So as far as the roles of a CHW, we do outreach in partnership with other city agencies that offer and provide support to pregnant and postpartum families. One of the things that CHWs take on is attending the pregnancy village in Bayview Hunters Point. It is a one-stop shop for families that need resources, and this takes place every second Saturday of the month, and it goes from I think the month of March all the way till December, and then there's a break in between that. And I will pass it back to Betty for on-the-job training.
Thank you, Christy. For on-the-job training, the beautiful thing, as Christy mentioned about the apprenticeship program, is that we combine the education with the on-the-job training. So after numerous months of the CHW is going through in-house training, aligning with work with CCSF, they begin to do the practicum, just put their skills into practice, of course, with proper shadowing and supervision. So some of the on-the-job training entails support with client intakes, support client services and triage log, within our departments, make sure that they're using a Salesforce database to enter client encounters as well. We also have the Wellness Wednesday, which this is it's for expecting parents to come in. We have every Wednesday orientations that we talked about, what it is to enter our services. We do have snacks for them, and also clothing, for the expecting parents to come in. And this is obviously this effort, in doing the orientations and provide, immediate support for the parents. Also, they help with group facilitation and counseling. CHW is also staff Friday food distribution and the diaper bank program, where they face for the community, when they can come in and obtain a food bag and also diapers for their children. And also any client donations that we have, anything that comes in, they're able to go through the donations and distribute to the community as well. Next slide, please. All right. I now want to take us to what it means to be a student for a CHW program. One of the things that Kirsty mentioned and I want to highlight is we wanted to eliminate barriers, especially for working low-income parents that might not be able to work for the whole 8 hours and then go to school afterwards. Actually, the teachers, like Kirsty mentioned, come to us. Eliminating barriers will mean really having the class here, having the class instruction here. So we work in partnership with CCSF, and they come to HPP for the instruction. Also, we provide a schedule block time for assignments and homework. And the Education and Employment Coordinator is available weekly to tutor the CHWs as well. Next slide, please. What we've learned so far is that pairing the on-the-job training with education really ensure that they gain practical knowledge and experience to move on to other roles upon graduation. And really providing a paid training with living wages is critical to the CHW success. As we mentioned, this program is for former clients or people from the community. So just having a living wage after going through this program is vital for making sure that they can feed their family pretty much as they're doing the training. And the key partnership that we have, of course, City College of San Francisco, OVWD, and Family Service Alliance. Next slide. All right. So far, since 1995, 232 people have participated in the program. Of these participants, 190 participants, 82% have graduated, and more than 89% have found jobs within 30 days upon graduation. And since launching the apprenticeship program in 2019, 32 of the 46 CHWs have graduated and obtained employment. What's next for us is the CHW expansion with family resource centered partners, leverage the partnership that we have, and have more availability for community to engage in the CHW program. And as current partners, the expansion that we've done, we have Instituto Familiar de la Raza, we eat Children's Services, and La Raza Centro Legal. So we have an extra 5 CHWs from these 3 agencies that are coming here to HPP for in-house trainings, and also have joined us for our CCSF classes as well. Next slide. I believe that's our last slide for the next one. All right. So thank you so much for your attention, and we're just happy to be here and happy to be part of this discussion. Thank you.
Thank you.
Thank you, Betty and Christy, so much for sharing about the work of Homeless Prenatal Program and creating those apprenticeship pathways with livable wages for people with lived experience to become community health workers and leaders, and serving homeless and low-income families in San Francisco. Thank you all panelists and grantee organizations. Let's give everyone a round of applause for sharing their great work. It's truly an honor to hear about your strategies and the impact over the last 10 years. I'm going to pass it to Kusi because we saw lots of questions in the chat and in the Q&A box, and she's going to moderate the Q&A session.
All right. Thank you, Allie. Thank you for sharing the evaluation findings, to the speakers about sharing about your organizations and programs that really demonstrate the impacts of the Amplifying Impact Initiative and all the work of your CHWs in our communities. So we'll now go into the Q&A session. I just want to remind everyone to please use the Q&A function at the bottom of the screen. And then please indicate if the question is for a specific presenter / organization or for the evaluation team. Okay. All right, I see a new question now. How was the on-the-job training program funded for the homeless prenatal program? Do you want to take that, Betty or Christy?
Sure. Like I said at the beginning, we've done this for the last 35 years. It was just through private funders. Once we became an apprenticeship program, late 2019, early 2020, then we went through our OEWD contract to become an apprenticeship program.
Thank you. Okay. Bridge Prenatal, you may have mentioned this, but do you provide training or shadowing opportunity for outside organizations? Yeah, I believe that question's for CTR, for the Bridge Prenatal.
Okay. Sorry. Yes. So we do provide training and shadowing opportunities for outside organizations. And we have a training program which we launched recently, and the first cohort will start in fall. And I would like to mention about the training program. It is the Community Mental Health Worker Training Program. It is HRSA funded training program. And so we are taking in the community health workers who can be trained as community mental health workers. And it is a 4-year program that will be starting this fall 2026. Other than that, if you are interested in shadowing the ECM and the community health worker team with us, you can always contact me or Andrea, and we will be able to connect you with our team members for the shadowing piece.
Thank you, Aparna. Okay. All right, here's another question. Any thoughts on ways that CHWs or organizations that train CHWs can assure their clients continue to receive benefits in the wake of HR 1 and changes to SNAP? such as providing volunteer or training opportunities or supporting folks with new documentation requirements. So I think this is more of a general question if everyone has thoughts on, they're asking about ensuring continued benefits with SNAP and
Maybe just to share what Aki is trying to do in the community, what we have been trying to do is partner with other organizations to actually just help us interpret the changes coming from HR1. So we've now we're now a part of a coalition that works with other CBOs trying to interpret it. And then we're doing the best that we can to work together to get the information out. And then we're prioritizing the information to go out to some of the CHW partners. So as soon as we understand and learn some of those changes, we do try to get the word out to our partners either through messaging campaigns or we will try to host a CHW training specifically for these changes.
Thank you, Gerard. All right. Yep.
Lucy, this is Carlina. I can try and give some response to that one as well, if that's helpful.
Thank you. Yes, please.
Yeah, I mean, I think there's a lot of conversation happening around the state about how folks can engage to support their clients. So I think a lot of state leaders are thinking about the role of community health workers, promotoras, and other trusted messengers. So I would encourage people to really keep tabs on the Department of Healthcare Services website and on our website, which I'll put in the chat, so that you can make sure that you're getting information about some of the training opportunities that are available and the updates to policies that are shifting. They will be sending out information in a whole variety of different languages that people can use to communicate with their clients. And I think there'll be more and more conversations going on about that related to community health workers and promotoras as time goes on. So I'll put a couple of links in the chat for people to take a look at.
Thank you, Carlina. All right, this next question. All right, this convener/network approach, Aki specifically, makes so much sense, exclamation mark. I'm on a learning journey here on behalf of my organization, Women's Cancer Resource Center, which serves Alameda and Contra Costa counties. We serve many different clients who have Medi-Cal and provide high-intensity cancer navigation services that we think would align well with CHW services. We're exploring whether and how we might be able to bill for these services. So their question is, they're curious if anyone can call out some coalitions that exist within either Alameda or Contra Costa counties. So I think also for the audience, if you have a response to that answer, please drop it in the chat for Heather Fell. Thank you. All right. Next question. Curious to hear about experiences developing multi-role CHWs who function as a medical interpreter, CHW, and medical assistant, for example, or whether responsibilities are strictly defined to CHW. That's a lot of functions, but if anyone can speak to developing multi-roles, like multi-function roles for CHWs on the panel.
I think one of the benefits and one of the successes we have seen at Aki is we've partnered with organizations that their staff already plays multiple roles, and they added CHW as a part of that role. We're finding success in the fact that they're already out in the community, they're serving the community, either providing information about community service or programming that they do, and then helping them train to provide health education actually ended up creating a much more robust workforce. And we didn't quite rely on just one person doing one hat. And so for us, we've seen some success in working with partners that actually have staff that can play multiple roles.
Thank you, Gerard.
Lucy, while we're waiting for an answer, I just want to remind people we've provided a couple of links in the chat to the evaluation, to the Amplifying Impact website, And I would encourage the folks to visit those for more information about what you've heard today. I also will put a link in the chat to the California Healthcare Foundation's Community Health Worker Resource Center, which was just launched last month, and it has a lot of information on CalAIM and Medi-Cal and working with managed care plans in California. So hopefully those are helpful resources to people.
Thank you, Carlina. All right. While we're waiting on Claudia, we go to another question. What does compensation look like for staff who can play multiple roles? Is it per cert? Oh, sorry. Is it per cert or per skill? How do employers better reflect the value of those people who can do multiple roles? I think this is specifically for Aki.
Yeah, thank you for that question. Many of the partners we work with, they do secure a braided funding strategy. So they get sources of funding from different sources, and then they braid all that together to pay for the cost of a position. So it's kind of hard to say if they get paid this much money for playing this particular role, or if they get paid this much money for doing a particular task, but they're actually being paid in a positional, in many cases, an hourly rate. And they do the work throughout the day, and they don't really split their time out unless they're doing specific billing for a particular project.
Thank you, Gerard. Okay. I'm just seeing if there's any more questions. All right. And Claudia, we'll send you a message. So if you let us know which specific program that you like more information on, then we can get you that information from the speakers. Okay. All right. I think that's it for questions. So we will transition. All right. All right, so we're going to transition to talking about Pillar 2, which is the next iteration of the Amplifying Impact Initiative. If you can go to the next slide, please. Okay. So this slide illustrates how community health worker workforce investment efforts have evolved over time. The capacity building collaborative focused on regional planning, financial sustainability, and helping organizations prepare for CalAIM implementation. The Amplifying Impact Initiative expanded those efforts by investing directly in organizations who employ and train community health workers. Today, the Pillar 2 Amplifying Impact Initiative, which is now funded by the California Department of Healthcare Access and Information, builds on past investments by providing significantly larger funding. Together, these initiatives represent a continuous investment in building a stronger and more sustainable community health worker workforce across California. Next slide, please. As the California Healthcare Foundation transitions leadership over to the Amplifying Impact Initiative, HCI has partnered with Health Leads to carry this workforce investment work forward. In this next phase, Health Leads serves as a lead agency supporting organizations through subcontracts to implement and amplify their community health worker investments. Through a competitive request for proposals process, organizations were invited to propose projects that would enhance workforce sustainability and strengthen organizational capacity through workforce support services and infrastructure investments. There was great interest in this project with 417 applications received. Our performance period for these subcontracts run from May 2026 through November 2027 with awards up to $250,000. We require that at least 51% of funding be dedicated directly to workforce support services. So this is money going directly to the CHWs themselves on the front line and services to support them specifically. While eligibility was broad, we prioritized community-based organizations with deep community trust and equity-focused programming. Next slide, please. It is my pleasure to share the names of the 25 awarded subcontractors of the Pillar 2 Amplifying Impact Initiative. We've also provided additional information about the 25 awarded subcontractors, including entity type, regions, and populations served within this slide deck, which will be shared to all registrants and attendees to view later on. So while folks view the awarded subcontractors, I'll also share a couple important resources. All right, so right now I'd like to invite everyone to click on the link in the chat where you can find the full Amplifying Impact Evaluation Report and featured case studies via the first link. And then if you'd like more information on the Amplifying Impact Initiative, you can also click on the second link, which goes to the landing page. All right, I will now hand the floor over to Carlina Hansen for some closing thoughts. Thank you, everyone.
Hi, everybody. I just want to thank you all so much for joining us today. I want to thank our speakers for sharing your experiences, for your honesty, and for your leadership. If you're still on, if you could give a shower of emojis for the folks that contributed all of their time and energy to those fabulous presentations and to the incredible work that they're doing. I want to thank all of you who joined us today, whether you're a community-based organization, a health plan, a provider organization. Advancing community-centered care is something that none of us can do alone. I want to acknowledge that as we look ahead, we do so in a moment of real uncertainty. Changes in federal policy, including HR 1 and public charge, mean that a lot of our communities may be more hesitant to seek care or engage with public systems. And at times like these, the role of community health workers and promotoras becomes incredibly important. It's vital and life-saving, not only because folks are trusted messengers, but because they help people understand their options, navigate systems, and stay connected to care. So while today's webinar marks the conclusion of this round of the Amplifying Impact Initiative, as Kusi shared, it is the beginning of the next chapter. We are excited to pass the baton to AACI, and we'll have the continuity of leadership from health leads for the next round of Amplifying Impact, which is going to build on the lessons that we have all learned together and shared today so that we can expand this work across California. Thank you so, so much for being part of this journey. And thank you for everything you do to ensure that, especially in uncertain times, our healthcare system and our community remain connected. And just sending you off with a lot of love and appreciation. So thank you very much. Take care, everybody.